Hey everybody, it's Dr. P. I'm back to talk about number 3 of 5 things patients should know about mammograms, which is the importance of prior mammograms. Um, I don't think a lot of patients understand the importance of having priors when they have a mammogram performed, but I'm going to actually show you some examples of what not having a prior available does. So these are some examples that I encountered this week. These are actual patients. Now, there's no patient identifying information. We're not concerned about HIPAA laws or anything like that. So there's this random patient came in and for a mammogram, and the story was that she unfortunately forgot where her prior mammogram was. And in this case, we see this little round ball in the right breast, which we call a mass. Now, this could be a cyst. This could be a benign fibroadenoma, which is a very common fibrous type tumor which grows in the breast, or it could be cancer. There's no way for us to tell. Now, if we had the priors, let's say it was a cyst, cysts typically grow and shrink, we could see that over time and we could say, okay, you're done, this is benign, we're not worried about that. Or if it's been the same size for several years, we could say that this is nothing to worry about. But in this case, unfortunately, there's no way for us to tell what this is, so we have to get an ultrasound, which means I've now got to put in the report that the patient should come back for additional imaging. Now, that causes a lot of anxiety for patients. It takes up a lot of time. Some patients have to get off from work or that kind of thing. And then, it also costs money, and everybody's concerned about that nowadays. But so I would like to be able to avoid that and try to stress the importance for every patient to have their screening their history of mammograms either in their possession or available from a medical facility. And this happens all the time. Here's another similar thing where we have a mass that we don't know what it is and we have no history. Here's another one down here, you can see, same thing. Or over here, another mass, same thing. And we get this all day long. And it's very unfortunate. A lot of potential problems could have been solved by having those prior mammograms. So what's my advice to patients? When you have your screening mammogram and you're done, before you walk out that building, say, I would like you to make a copy of my images. Number one, it's your right. These are your pictures. It's your breast. You have a right to that. They're not going to offer to do it, so you have to ask. It costs them money and time and effort, and a lot of places, are trying to be more efficient, and to be quite frankly, some places even use it as a means of control. They don't want to give you your priors because they want you coming back to them. But it's your right. Get them on a disc, and if anybody gives you a hard time, don't ever go back to them. Get it before you walk out, but don't go back, because that's not the type of place that you should be doing business with. But anyway, that's my advice, and I hope everybody recognizes the importance now of having prior mammograms.